New government data shows nearly 29 million Americans do not have health insurance. 22 million of those who do have medical insurance use Aetna. It is the third largest provider in the country. But that number could soar if regulators and shareholders approve CVS Health's $69 billion acquisition of the health insurer. CVS has more than 10,000 pharmacies and clinics across the country. Those could soon become one-stop shops for preventative care, treatment, and filling prescriptions. Mark Bertolini is chairman and CEO of Aetna. He's with us at the table. Welcome back.
Good morning.
Would this be the largest American health insurance deal in history? Is that right?
I think so.
The largest ever. Okay, so the question is, how's it going to change the way I get health care?
Well, I think in the healthcare industry, we've got things backwards. What we do is we sell health insurance first. And I use an analogy, being a Detroit boy, of buying an automobile. You don't go to GMAC to buy a car. They finance cars. Health insurers are really financiers of healthcare. We go to a dealership, talk about our ambitions for our transportation. What is it we want? And then we go finance it later on. But in healthcare, we finance everything first. We get a warranty card that says if you're broken, show up at a doctor's office and we'll fix you. And that's got the system all upside down. It's backwards.
Right. We're also required by law to buy car insurance. We're not required by law to buy health insurance.
Right.
Somewhat so under Obamacare. But I mean, practically speaking, is this going to bring down the cost of prescription drugs?
Definitely. So here's how we think about it. People don't define their health as a disease. They define their health as a barrier to living the life they want to lead. I'm a spinal cord injury survivor. I don't describe myself that way. But I have neuropathy that gets in the way, pain that gets in the way of me living the life I want to lead.
So what's the question we should be asking about our health?
What is it about your health that gets in the way of you living the life you want to lead? And if we understand that person by person, we can actually solve that problem.
Yeah, but I asked about prescription drug costs.
Yep.
So how are they going to be higher or lower under a merger like this?
Prescription drug costs are just a part, 15 to 20% of the equation. We need to look at the whole cost of care, the whole total therapy. What is the best solution? When Sovaldi came out for hepatitis C, we solved that problem by just saying, sure, we're going to pay for it, because it's the other costs associated with hep C are so catastrophic. It was better for us to get people treated and cured.
The concern with this merger is, going back to your car analogy, is that basically what's going to happen is people are only going to have a choice between two cars, and that the lack of choice, the consolidation means prices might go down a little bit at first, but then you can't go anywhere else. New entrance to the market can't happen. What's the argument? What's the rebuttal there?
Well, why would people only have two choices?
Well, because you're making you're offering them what their choices are. So it's totally up to you. They can't make choices based on price. You're the only game in town.
We can't force people into CVS.
But if it's the only drugstore in town, and that's where I'm getting my health care.
Yeah.
But there are plenty of drugstores in town. So there's Walgreens, and there are independent pharmacists, and there are a whole host of other pharmacies.
So you would welcome, say, Amazon getting into the business to compete with you?
I think the more competition we have, the better. It keeps the system honest.
So there's not going to be any problem with so they've just got no case at all in terms of these fears that there would be too much consolidation.
It doesn't make sense for CVS to turn off all their other customers just for the 22 million Aetna customers when they serve over 100 million people today.
Well, explain that integration, because what I've read about it, what you think that CVS and Aetna can do together better.
So in today's environment, 60% of our life expectancy, which has gone down 2 years in a row, is associated with where we live. 30% is our genetic code, and 10% is the clinical care you receive. So now our zip code matters more than our genetic code and how long we live. And unless we get into the community and we begin to provide services in the community that deal with issues like social isolation, food, water, accessibility, access, if we can do more of that in the community and near people's homes, then we're going to win, because we're going to keep people healthy around the issue that prevents them from living the life they want to lead.
So does that mean CVS gives Aetna the storefront, essentially, to do that?
The storefront becomes a place, call it 10,000 new front doors to the healthcare system. And what we want to do is provide as many services as we can in the community to meet social determinants, that's 60%, versus waiting for people to show up in the healthcare system broken and fix them.
And the benefit for CVS is I come in to get a check-in on my cold, and I'm also picking up products from CVS when I'm going there for that other reason.
No, it's the whole idea that if we keep people healthier, there's lower costs in the system, and when CVS is the insurer, that's an advantage for them because they're getting the full premium. I get the premium dollar, therefore, if I can reduce costs by keeping people healthier. We found this in Medicare Advantage. The more we invest in individuals around their illnesses and keeping them away from the healthcare system, the better off we are.
Mark Bertolini, be interesting to see these changes. Thank you so much for joining us this morning.
Good to see you.